For my video, I will be talking about how a Mediterranean diet can help reduce the incidence of type 2 diabetes. The topics that I will be covering in this video are the prevalence, causes, and symptoms of diabetes, the components of a Mediterranean diet, the benefits of a Mediterranean diet, and the research that has been done regarding a Mediterranean diet and type 2 diabetes. Type 2 diabetes is a chronic disease. A chronic disease persists for a long period of time and is usually caused by lifestyle factors, environmental factors, or genetics. Type 2 diabetes progresses over time and can be slowed or prevented with changes to lifestyle habits. When someone has type 2 diabetes, their body becomes insulin resistant or no longer produces enough insulin for the cells to use. When the body doesn't have enough insulin or can't use it properly, the glucose in the body is not taken up by the cells, causing high blood sugar, also known as hyperglycemia. Elevated blood sugar levels for prolonged periods of time can have negative effects on the whole body. According to the Center of Disease Control and Prevention, about 38 million Americans have diabetes, which is around 1 in 10 people. Out of those 38 million, 90 to 95% of them have type 2 diabetes. 8.87 million people have undiagnosed diabetes, and 97.6 million adults have prediabetes. Insulin is a hormone produced by the pancreas. It regulates blood sugar levels by allowing cells to take in glucose from the blood for energy. Insulin also helps the body convert excess glucose into glycogen as a form of energy storage in the liver and in the muscles. Insulin resistance is when the cells in the body no longer respond to insulin and do not properly take in glucose from the blood. There are many contributing factors that can lead to the development of type 2 diabetes. Some of the main causes include being overweight or obese, not being physically active, having an unhealthy diet, and genetics. Having excess body fat can lead to type 2 diabetes because adipose tissues release substances known as adipokines that help with insulin sensitivity. When there is excess visceral fat in the body, these tissues release pro-inflammatory adipokines. When adipokines become dysregulated due to the high number of pro-inflammatory adipokines, it can cause insulin resistance. Excess fat also causes inflammation in the body, which can interfere with function. Exercise helps improve insulin sensitivity and glucose utilization. Exercise helps stimulate the body to use glucose for energy. A lack of regular exercise can lead to weight gain, inflammation, less glucose utilization, and therefore lead to insulin resistance. Diets high in refined sugars, unhealthy fats, and low in fiber can contribute to obesity and insulin resistance as well. A diet with a lot of processed foods and sugary drinks, such as soda, increases the risk of type 2 diabetes as it leads to excess fat and inflammation. Genetics can play a role in developing type 2 diabetes as well. Some people may be predisposed to developing it due to the genetics. Some symptoms of diabetes include more frequent urination, excessive thirst, fatigue, weight loss, and an increase in infections. When blood sugar levels are high, the kidneys are not able to take in all the glucose in the body, so it is excreted in the urine. This excess glucose combines with water, causing increased urine production and frequent urination. Elevated blood glucose levels can lead to an increase in thirst as the body tries to flush out excess sugar through urination. Because glucose is not being used effectively for energy, the body cells do not receive an adequate energy supply, leading to fatigue and weakness. To make up for the fact that glucose isn't used efficiently, the body starts breaking down muscle and fat for energy instead, resulting in weight loss. Elevated blood sugar levels impairs the functions of the immune system. This slows down the body's ability to heal wounds and fight infections. A Mediterranean diet consists of fruits and vegetables such as berries, apples, kale, and eggplant, whole grains such as oats, brown rice, and quinoa, healthy fats such as salmon and olive oil, lean proteins such as turkey and chicken, avoiding red meat, moderate dairy intake such as Greek yogurt and low-fat cheese, herbs and spices, and a moderate wine intake. Fruits and vegetables provide minerals, vitamins, and antioxidants. Whole grains provide fiber and nutrients. Healthy fats provide omega-3 fatty acids, monounsaturated fatty acids, and polyunsaturated fatty acids. Red wine provides antioxidants, and lean protein provides amino acids and increases satiety. Now, let's talk about the health benefits of a Mediterranean diet. A Mediterranean diet consists of foods that have a low glycemic index. Due to the low glycemic index of these foods, they have a smaller impact on blood sugar levels and do not cause rapid spikes. This diet is also high in dietary fiber, which slows down the digestion and absorption of carbohydrates. Dietary fiber also helps prevent rapid spikes in blood sugar after eating and helps maintain stable blood sugar levels and increases insulin sensitivity, which means that cells are more responsive to the glucose in the blood. The increase in whole, nutrient-dense food rather than processed food promotes weight loss and weight management. Losing excess weight and maintaining a healthy weight helps avoid insulin resistance and increases insulin sensitivity. This is a diagram from a review by Schroeder et al. Titled Protective Mechanisms of a Mediterranean Diet in Obesity and Type 2 Diabetes from the Journal of Nutritional Biochemistry. This is a diagram showing the proposed mechanisms between a Mediterranean diet and weight control. Here it shows that a high intake of legumes, fruits, vegetables, and cereals will increase fiber intake in the diet, leading to more satiety, which will reduce calorie consumption. Olive oil and fish in the diet will provide unsaturated fats that lead to fat oxidation. Both fat oxidation and satiety will help with weight control. A Mediterranean diet consists of monounsaturated fats and omega-3 fatty acids. These healthy fats reduce inflammation and support heart health. This diet also has a lot of fruits, vegetables, herbs, spices, which provide antioxidants and anti-inflammatory properties. Chronic inflammation is associated with insulin resistance, and the anti-inflammatory properties of these foods may help reduce the inflammation. Antioxidants help neutralize free radicals, which are molecules that can contribute to inflammation and oxidative stress in the body. Now let's look at some more research that has been done. A study was done to assess the relationship between a Mediterranean diet and type 2 diabetes. It is titled Adherence to a Mediterranean Diet and Risk of Developing Diabetes. This study was done by Martinez Gonzalez et al. In 2008. The goal of the study is to assess the relationship between a Mediterranean diet and the rate of diabetes among participants who did not initially have type 2 diabetes. This is a prospective cohort study. 13,380 university graduates without diabetes at the start followed a Mediterranean diet for around 4.4 years as data was collected. It was found that participants who followed a Mediterranean diet closely had a lower risk of type 2 diabetes. Another study was done to compare a low-fat diet and a Mediterranean diet to see which one was more effective in preventing type 2 diabetes. It is titled Reduction in the Incidence of Type 2 Diabetes with a Mediterranean Diet. This study was done by Salas Silvato et al. In 2010. The primary goal of this study is to test the effects of a Mediterranean diet in comparison to a low-fat diet on the rate of developing type 2 diabetes. This is a randomized clinical trial. 418 non-diabetic participants aged 55 to 80 years old were followed for around 4 years and put into 3 dietary groups: an olive oil group, nuts group, and a control group. It was found that a Mediterranean diet without calorie restriction appears to be effective in the prevention of type 2 diabetes. According to this study, Figure 1 shows that cumulative diabetes-free survival was lower in the control group compared with both Mediterranean diet groups. After adjustment for various confounders, incidence of diabetes was reduced by 51% in the olive oil group and by 52% in the nuts group, in comparison with the control group. A third study was done titled Rat Models of Diet-Induced Obesity and a High-Fat, Low-Dose Streptozotocin Type 2 Diabetes. This study was done in 2015 by Amy Holmes et al. The central goal of this study was to determine whether replacing the high-fat diet with a normal diet would improve glucose utilization when looking at type 2 diabetes. This is an animal study. At 12 weeks of age, rats were separated into 9 groups. 8 of these groups were placed on a high-fat diet. The remaining group was put on a normal diet. Afterwards, 4 of the high-fat fed groups were treated with streptozotocin. The rest were put back on a normal diet. Replacing the high-fat diet in diet-induced obese rats with normal diet improved glucose utilization and reduced fatty liver. This is another figure from the protective mechanisms of the Mediterranean diet in obesity and type 2 diabetes from the Journal of Nutritional Biochemistry. This figure shows proposed mechanisms that link a Mediterranean diet and the prevention of type 2 diabetes. Looking at this figure, we can see that, as mentioned before, the fiber content in this diet delays stomach emptying. The antioxidants in this diet increase oxidative capacity, and magnesium provides ATP and phosphate transfer associated enzymes, and moderate alcohol intake provides adiponectin. All of these help with the prevention of insulin resistance and the prevention of pancreatic beta cell dysfunction, which helps prevent type 2 diabetes.